My name is Richard Tyus. I'm 60 years old. I'm from Prattville, Alabama. Well, I learned about my elevated PSA just on a regular doctor visit. First, I didn't even know what an elevated PSA was. My primary doctor decided that I should go see a urologist, and he referred me to Dr. Richardson in Montgomery. And so he set me up for a biopsy. Well, you know, when my results came back, Dr. Richardson explained to me that it was prostate cancer.
Richard's like one of those 265,000 or so men per year who get diagnosed with prostate cancer. When you get that initial cancer diagnosis, no matter what somebody says, your mind is so kind of baffled and you're just kind of out in space, kind of in shock.
Well, being diagnosed with prostate cancer at 59 and no family history of anything like that made me feel very awful.
When I heard my brother was diagnosed with prostate cancer, the first thing I thought that this has got to be really bad. I mean, when someone hears the word cancer, the first thing comes to their mind is death.
I was in a situation where I'm dealing with something that I had no knowledge about, and I'm pretty much at the mercy of whatever anybody tells me, and that's an uncomfortable feeling for me. I received a second opinion out of Birmingham. He thought I needed to get the radiation treatment and hormone therapy together. You know, there was just times, you know, when you hear different things from different people, that you kind of want some clarity. Any decision that you make in life is going to be based on the amount of information that you have. If your information is no good, your decisions are no good. I started looking for some kind of answers and things that I could try to do. I had already been researching, going out on the internet, just trying to Google prostate cancer. And this little bar pops up on the internet that says you may qualify for a Prolaris test. I had never heard of what Prolaris was, but it sounded interesting. I read that if you had not had any kind of treatment already, that you would qualify for the test. And so I decided to go ahead and fill out my information. I get this phone call, and I can say that it was one of the most important phone calls I've ever got in my life. After I got off the phone with Marriott customer service, I called Dr. Richardson's office and asked him if they would order it for me.
I find that Prolaris is that test that helps me answer what I think is the most important question when I diagnose a patient with prostate cancer, and that is the choice between active surveillance versus active treatment. As they leave the office, I feel confident that not only what I've said they understood, having a results page that's easy to read, concise, lets the patients kind of go back at home and rethink everything that we've talked about.
The Prolaris test results gave me all of the confidence that I needed.
He seemed a little withdrawn before that test, but after the test, it made him feel like a different person. Now we're spending more time together. We're playing pool together a little more often.
Based on the Prolaris test, it said that I could do a single treatment. And I think I've got a pretty good idea which one I want to do. This test has really changed my life.